Hello everyone, I am Deepika, working as an assistant professor in RPIIT Technical and Medical Campus, Bastada, Karnal. Today, in this video, we are going to discuss about different routes of administration. First definition: a route of administration is the path by which a drug, fluid, poison, or other substances is brought into contact with the body. Next is its classification. Route of administration can broadly be divided into topical, oral, parenteral, rectal, and inhalation routes. These are the different routes by which the drugs are applied: topically, oral, parenteral, rectal, and inhalation. So, in topical route, drugs are applied topically to the skin or mucous membrane mainly for local action. जब हमें लोकल एक्शन चाहिए होता है तब हम क्या करते हैं, टॉपिकल एप्लीकेशंस का यूज़ करते हैं। हम अपनी म्यूकस मेम्ब्रेन्स होती हैं, स्किन होती है, अप्लाई करते हैं। नेक्स्ट इज ओरल route. This route is used for systemic, means non-local effect. Substances are given by the digestive tract. हमारे जो GI ट्रैक है, डाइजेस्टिव ट्रैक है, उसके थ्रू हम सब्सटेंस को गिवन करते हैं। पेरेंटरल रूट: अ ड्रग एडमिनिस्टर्ड पेरेंटरली इज वन इंजेक्टेड बाय अ होलो नीडल। होलो नीडल की हेल्प से हम इंजेक्ट कराते हैं इनटू द बॉडी एट डिफरेंट साइड्स टू वेरिंग डेप्थ। अकॉर्डिंग टू डेप्थ उसमें क्या होती है, डिफरेंट साइड्स यूज़ होती हैं। रेक्टल रूट: ड्रग्स गिवन थ्रू द रेक्टम बाय सपोजिटरीज और एनीमा। Inhalation: the lungs provide an excellent surface for absorption when the drug is delivered in gaseous, aerosol or ultra-thin solid particle form. Topical route: फर्स्टली जो हम स्किन पे अप्लाई करते हैं, थर्मल और ट्रांसडर्मल। डर्मल क्रीम होगी, ऑइंटमेंट्स जो कि लोकल एक्शन देते हैं, एंड ट्रांसडर्मल absorption of drug through skin, that is systemic action. Stable food levels, controlled drug delivery system, no first pass metabolism, and drug must be potent or patch become too large. Mucosal membrane: eye drops onto the conjunctiva, ear drops, intranasal route into the nose. Oral route can be given by swallowing. It is intended for systemic effect resulting from drug absorption through the various epithelia and mucosa of the gastrointestinal tract. Advantages of oral route: convenient, means portable, no pain and easy to take, cheap, not need to sterilize, compact, multi-dose bottles, automated machine produce tablet in large quantity. वैरायटी आती हैं इसकी टैबलेट्स, कैप्सूल, सस्पेंशंस एंड मिक्सचर्स। डिसएडवांटेजेस: समटाइम्स inefficient, low solubility drug may suffer poor availability, example graciofulvin. Second, first pass effect: drugs absorbed orally are transported to the general circulation by the liver. Thus, drugs which are extensively metabolized will be metabolized in the liver during absorption. Example propranolol. First pass effect: the first pass effect is the term used for hepatic metabolism of a pharmacological agent when it is absorbed from the gut and delivered to the liver via the portal circulation. The greater the first pass effect, the lower bioavailability of the drug, means the rate and extent drug reaching systemic circulation. Oral route: थर्ड इसमें है food and GI motility can affect drug absorption. Often patient instruction include a direction to take with food or take on an empty stomach. Absorption is slower with food, milk and milk products for tetracycline and penicillin, etc. However, for propranolol, bioavailability is higher after food, and for glycophenolane, absorption is higher after a fatty meal. थर्ड रहता है हमारा बक्कल एंड सबलिंगुअल रूट. सम ड्रग्स आर टेकन एज स्मॉलर टैबलेट्स विच आर हेल्ड इन द माउथ लाइक बक्कल टैबलेट्स और अंडर द टंग आर सबलिंगुअल टैबलेट. Buccal tablets are often harder tablets. 4 hours disintegration time रहता है and designed to dissolve slowly. Example is nitroglycerin as a softer sublingual tablet. 2 minute disintegration time रहता है and may be used for rapid relief of angina. Advantage is avoid hepatic first pass, rapid absorption and drug stability. Disadvantage is holding the dose in the mouth is inconvenient. Small dose only can be recommended easily. Parenteral routes. So these are the different parenteral sites. Intramuscular, subcutaneous, intravenous, epidermis, dermis, subcutaneous tissues and muscles with vein. So parenteral route फर्स्ट है हमारा इंट्रावस्कुलर जिसको हम IVIA बोलते हैं. प्लेसिंग अ ड्रग डायरेक्टली इनटू ब्लड स्ट्रीम मे बी इंट्रावेनस इनटू द वेन और मे बी इंट्रा आर्ट्रियल इनटू द आर्टरी. Advantage is precise, accurate and immediate onset of action, 100% bioavailability. Disadvantage is risk of embolism. High concentrations attained rapidly leading to greater risk of adverse effects. सेकेंड है इसका इंटरमस्कुलर जो इनटू द स्केलेटल मसल्स हम प्रोवाइड कराते हैं. एडवांटेजेस रहती हैं सुटेबल फॉर इंजेक्शन ऑफ ड्रग इन एक्वस सॉल्यूशन, रैपिड एक्शन एंड ड्रग इन सस्पेंशन और इमल्शन विच आर सस्टेन्ड रिलीज. Disadvantage is pain at injection site for certain drugs. Subcutaneous, which is given under the skin, example insulin. Intradermal, into the skin itself, is used for skin testing some allergens. Next, intrathecal, into the spinal canal, is most commonly used for spinal anesthesia. Intraperitoneal, infusion or injection into the peritoneum, example peritoneal dialysis in case of renal insufficiency. Next is rectal route, most commonly by sphygmostry or enema. Advantages: first pass bypass liver, means some of the veins draining the rectum lead directly to the general circulation, thus bypassing the liver. Reduced first pass effect. Useful, this route may be most useful for patient unable to take drugs orally, means जो unconscious patient होते हैं वो orally नहीं ले पाते तो उस केस में हम rectal route के थ्रू देंगे और with the younger children's if patient is nauseous or vomiting. Inhalation route used for gaseous and volatile agents and aerosols. Solids and liquids are excluded if larger than 20 micron, the particle impact in the mouth and throat. Smaller than 0.5 micron, they are not retained. Advantages: large surface area, thin membrane separate alveoli from circulation, high blood flow. As a result of that, a rapid onset of action due to rapid access to circulation. Disadvantages: most addictive route of administration because it hits the brain so quickly. Difficulties in regulating the exact amount of dose. Sometimes patient having difficulties in giving themselves a drug by a inhaler. So it's all about the different routes of administration. Thank you. Have a nice day.